Nelson. I'm a nursing student at Nevada State College, and I will be demonstrating how to insert an NG tube. So I'm going to begin by knocking on the door. Knock, knock, knock.
Come in.
I will provide privacy for my patient. Sanitize my hands for 30 seconds. Hello, my name is Karina Nixon. I'm a nursing student at Nevada State College. I'll be assisting your nurse today. I have some orders from your doctor. Before I begin, may I please verify your name and date of birth?
Yes, Eric Nelson, 8/19/79.
Eric Nelson. Okay, Mr. Nelson. So I have an order here from your doctor. An order to insert an NG tube. Do you know what an NG tube is?
Somewhat.
Someone, have you had this procedure done before?
No.
No. Okay, so an NG tube is a nasogastric tube that goes into your nose and down into your stomach, and it can help by providing nutrients, administering medication, and it can also decompress your stomach as well.
Okay.
Are you okay with that?
I guess so.
Okay. So I'm going to begin by, I need to check your ears, check your nose. So I'm going to just check, can you look up please?
Uh-huh.
Alright, so I'm just checking your nose for any lesions, abrasions, obstruction. Okay, can you hold down one nose
Uh-huh.
and breathe in and out? Very good. And then your other nose, please. Very good. Okay. So I'm going to insert the NG tube in your right nostril. Is that okay?
Yeah, that's fine.
Okay. So we did that.
Just put it back where you found it.
I'll bring everything back. Okay. So I have my tube here. It's a gastric sump tube, French 16, and I'm going to correlate that with my MAR. And this is what we're told to use. I'm going to put on some gloves. How are you doing, Mr. Nelson?
Yeah, a little nervous.
Okay, so I'm going to talk you through this. I'm going to get set up first.
Okay.
So this is the NG tube. I have to measure my positioning first. From the tip of your nose to your earlobe, down to your xiphoid process. And I'm going to measure this, put a tape on it. So let me get you set up. Got a towel around you. Okay, so Mr. Nelson, you got a towel. I have a cup of water here for you.
Okay.
So I'm going to begin. I'm going to lubricate my tube with some water-soluble lubricant. So Mr. Nelson, I'm going to have you lift your head up. I'm going to start inserting the tube into your nose. If there's any uncomfortability or you need me to stop, just raise your hand. All right, and I'll talk you through this, okay?
Okay.
Okay, so put your head up, please.
So these two are going to go down your nose, to the back of your throat, and it's going to go up.
Okay, so head up. And at the same time, my patient is seated in Fowler's position. All right, so very good. All right, I'm going in. Okay. How are you doing?
Good.
Okay, so now I need you to put your head down. I'm going to keep inserting. Very good. And to my point, my marker, and this is as far as it can go. And at the same time, I'm going to have to check in his back of his mouth if there's any coiling. And there's none. Okay, Mr. Nelson, how are you doing?
Good.
Okay, did you need some water?
Yes, please.
You can take a sip.
Thank you.
So So now I need to determine if it's in the right position, if my tubing is in the stomach. And there's 3 ways. The most efficient way is through X-ray. Another way is by pushing air into the stomach and listening for swishing sounds. So I'm going to do that. Sanitize my stethoscope.
Has more air.
So, Mr. Nelson, I need to check to make sure that my tubing is in the right position.
Okay.
Do I have permission to go under your gown?
Uh-huh.
Follow my direction.
So I'm going to insert about 20 cc's of air.
If you want me to stop, just raise your hand and we can stop. We can take a break and try it again. So, I have some stations right here.
Okay, so I'm going to go under your gown. I'm going to look in the in the epigastric area. So I'm going to insert the air and listen for swishing sounds.
And before, I'm glad that you're sitting because this is the perfect position.
Okay, I heard the swishing sound, so that's a great indicator
Okay.
that my tube's in the right area. I also can do the 3rd step is aspirate. So I can aspirate some gastric juices from the stomach, about just enough to test the pH.
I'm going to measure to see what the appropriate length that I need to insert. So I'm going to measure from the tip of the nose, around the ear,
And I would test it with a pH strip.
and then I'm going to make a mark right here with
And I would check the color. It should be less than 5. And if it's less than 5, the acidity indicates that it's in a proper position in the stomach, and it is. Okay, so we are in a proper position, Mr. Nelson. I'm going to go ahead and secure your NG tube. So I'm going to do 2 points, one on your nose and one to your gown.
repeat the tip of my index. Okay, so we're going to be get ready to start. Remember, you have your tissues right here. Water.
So we're here.
When I start inserting the
Tape on your
and then you
nose.
start feeling that you're gagging,
Secure it so it doesn't come out.
like start swallowing and drink a little water, and that's the way that you can help to make these
Okay,
processes.
how is that, Mr. Nelson?
It's good.
So first, I already lubricated the tip of my
This off you.
and we're going to hyperextend.
Then I'm going to secure this onto your gown.
So I'm going to
Okay.
start inserting. Just take a deep breath, and we're going to go right in.
Give some slack for movement.
Now
Extra securement.
and make sure that the tube is not pulled.
Okay, Mr. Nelson, I'm going to be leaving. I'm going to situate your bed to the lowest form. And how are you positioned? Is that a good position for you?
I'm good.
Okay, do you need anything before I leave?
No.
Okay, if you do need anything later, just use your call light. And at this point, if the order says to connect it to a vacuum or a pump, I would, but it doesn't right now, so I'm going to leave it here for now. And take off my gloves. Sanitize my hands, 30 seconds, and I would. So at this point, I'm going to document the type of what I did was an NG tube, the type of tube, which was the gastric tube, the size, which is a French 16, and how the patient tolerated. I'm going to continue now and show you how to take out an NG tube. So I would knock on the door, provide privacy, introduce myself, verify the patient's name. So Mr. Nelson,
Uh-huh.
Karina, I'm back again, the nursing student from Nevada State College. Could you please verify your name and birth date?
Eric Nelson, 8/1979.
Okay, so we have the order to take out your NG tube. So we're gonna go ahead and do that. Is that okay?
Yes.
Okay, so I'm gonna put the patient again in the Fowler's position.
Stethoscope on.
Get my gloves.
Insert 5 to 20 minutes of air while I listen to the washing sound and then after the water.
So I'm gonna prep my patient with a towel or napkin. I have a cup here. I have some napkins here. My Emerson basin, just in case. So, Mr. Nelson, we're going to take the NG tube out. I have an Emerson if you need to spit or anything like that. A cup of water here and tissue to blow your nose at the end or for anything later. So, I'm going to begin by making sure this is unplugged if it is plugged, so it's not plugged in. Taking off the tape. Okay, so Mr. Nelson, I'm going to talk you through this.
Okay.
So I'm going to take the tape off.
Thank you.
To take this off, I'm going to have you take a deep breath in on the count of 3, and then hold your breath, and I'm going to take the NG tube out. Do you understand?
Absolutely.
Okay, on the count of 3, take a deep breath in and hold your breath. 1, 2, 3. Okay, very good.
Wow. I didn't even feel it.
Good job. So you can wipe or blow your nose if you need. A cup of water, Emerson basin, and at the same time I'm checking my NG tube, making sure it's intact, if there's no missing pieces or anything, and I would discard of it as needed. Okay, so just check with my patient if he needs anything before I leave to document. Do you need anything, Mr. Nelson, before I leave?
I think I'm good. Thank you very much.
And I'm going to take my gloves off. So at this point, I'm going to document again that I took the NG tube out of Mr. Nelson, the type of tube I used, which was a gastric tube, the size, which was a French 16, and how the patient tolerated the procedure, and he did very well. So that's the end of my NG tube insertion and taking it out as well. Thank you.